Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Hello health champions, welcome back to another episode of A Slice of Health. Today we're going to be talking about a subject that is near and dear to my heart, as you all know, endometriosis. And we have the amazing Dr Nitu Bajekal, who is an obstetrician and gynaecologist with over 35 years of experience. And she's going to be talking to us also about how to use a plant-based diet to improve your health, to improve your lifestyle, and also to improve gynecology outcomes. Welcome to the episode.
Thank you, Mo. And I'm so excited to be talking to you, especially about a topic that really affects a lot of women, remains undiagnosed for years, and causes a lot of distress. And so it's a topic close to my heart. I have had a lot of patients, a lot of experience, both in the medical and surgical field, but also more recently with lifestyle medicine. Yeah. So thank you for inviting me.
I'm so happy to have you on. Tell us a lot about yourself and how you came into being an obstetrician and gynecologist as well.
So I actually was born in India, and I didn't. My sister and brother were both doctors, and they were a bit older than me. And I thought, oh, that sounds quite cool. And although I was more sporty, I thought I will do medicine. I was very lucky. I got into the top medical schools, and I went to Pondicherry, which is a lovely medical college right near the sea. I met my husband at the age of 18. We were, of course, not married at that time. And very quickly, I realized that obstetrics and gynecology was a specialty for me, because I couldn't find that mix of surgery, which I loved, medicine, which I loved, and psychology. And so I knew that either I would become a GP or a OBGYN, but surgery is something that I really loved. So that was the path I took. And 35 years later, I just still find it just as thrilling. Oh, wow. Love it. And then my path took me to do post-graduation in Delhi, in India. And again, in one of the top medical schools, All India Institute of Medical Sciences. I was really happy. But we were 28 by the time we finished every single degree that was there in India. So we thought we had itchy feet. So we thought we'll travel around a little bit abroad before we return to India. And 29 years later, we are still here in England. And so I came here, finished my training. I did a fellowship in minimal access surgery. So one of my big interests is keyhole surgery, and I used to do robotic operating as well. I gave up obstetrics about a year ago so that I could focus more on lifestyle medicine. And so over the years, I have always enjoyed teaching and education, both for the public. So I set up Women for Women's Health in 2014, which is a voluntary organization, so that I can empower women and the community and men and people from all over to sort of educate themselves, because there's no point going in for any medical procedure or any medications unless you know the pitfalls and the benefits. And rather than relying on somebody else, my strapline often is, nobody knows your body better than you. So I have been very active on the teaching front, both for medical students and trainees and for the public. And in about around 2002, maybe a little bit earlier, when I was about 38, I started going through an early menopause, and I didn't realize it was stress. As most doctors, you're always in denial. and you're always too busy, and I had 2 young daughters, a dog, and a husband who was also very busy. So, and we had no family here in England. So it was always a juggle between everything. We were both very ambitious, both very career driven. So I realized that I was really quite suffering quite a lot. But then what happened was my younger daughter came home and decided that I was already vegetarian. I had stopped eating meat just after my younger daughter was born in 1992. But I was still consuming dairy, and she came home and decided that she was going to give up all animal products. So suddenly, eating sausages and chicken, she went to eating uh, plants. And I found a huge benefit in my symptoms, but I didn't put it down to food because I didn't realize. I just thought it was coincidence, as usual, because we had never been taught nutrition in medical school, as you know.
Yes.
And so life went on until I started realizing that I was feeling much better, much more energetic than I ever did before. And also, when I talked to my patients about it, just telling them to eat a bit better, they were finding a lot of improvement. But I became quite angry somewhere down the line when I suddenly realized that there was actually a wealth of information out there about plant-based eating, and all hundreds, thousands of peer-reviewed studies. And I hadn't been made aware of this at all, and I had to find this out on my own. So I've made it my mission to empower women, and that's how Women for Women's Health came about. And then realized that the diet that is actually the best or kindest for our health is the kindest for the planet and is the kindest for the animals that I was trying to help. So for me, it was a really win-win situation, but upset as a doctor whose main role is to help patients, that I was failing them, not having known this information, because it's up to the person then to go and do what they want. But if I didn't empower them with information, they would have to be in that same situation as me, that they would have to go hunting for this information. You see? So that's how all this came about. And then a whole lot of things happened, and suddenly lifestyle medicine, there's a board exam that's run by the American College of Lifestyle Medicine that opened it up about 2 years ago, I think, or maybe 3 years ago, to UK and Australia. And I was the first. There were about 29 people who sat the exam, a few mostly GPs, some physiotherapists, some nutritionists, and my husband and I were the first 2 specialists. He's orthopedics, back surgeon, and me, a gynecologist. And so we are both board certified. And my daughter, who's a nutritionist, she's also American College or International Board Lifestyle Medicine board certified. So it's been a fantastic addition to my toolkit, so I can help women, because some people will always need surgery. But if you can actually avoid reaching that stage where you might need medication and surgery, hey, what can be better than that? Especially if you're doing it by eating, not counting calories, not having to worry about putting on weight, and eating delicious food. I mean, for me, that is a no-brainer. So that's where I'm at. I've got a very active website, lots of information, and I love cooking. So I put a lot of recipes, because often people want to make the change, but they don't know how to. Yes. So teaching people how to transition to a plant-based way of eating, that understanding that any little change is actually better than no change is all you need to do. Because people freak out. They get really scared if you tell them you're never going to eat a cheeseburger again. So you say, yes, you just do this for 3 weeks, or just take breakfast and change it. That's all you need to do. And then once they understand how well they feel, they think, wow. My husband, he took 15 years because he thought he was eating really healthily. He had given up meat at the same time as me, but he was eating eggs and fish. And he thought they were really healthy, and he became diabetic. He tried all kinds of diets, and he wasn't getting better. And then he saw forks over knives, and I had gone to work, and I came back and I said, and he said, oh, I'm going to join you. I'm going to become plant-based. I said, wow, what did I say 15 years later? And he said, no, you didn't say anything. I actually saw a movie. I said, okay. But, he reversed his diabetes within about 2 or 3 months. It was supposed to be pre-diabetes, but I think he was pretty diabetic if you look at his results. And he dropped his cholesterol, I don't know, from something like 300 down to 130. And he now just looks at me and says, why did you not force me? This is the best way. I can eat what I want, how much I want. He used to look at food before and put on weight. He lost about 25 kilos. So that took a little longer, but the diabetes went first. So amazing.
That is absolutely amazing. And what you just said about, your husband's experience is something that I try to remind people a lot, especially in the pre-diabetes stage, is that once you get sort of this warning sign, there's a lot that you can do in your lifestyle that can prevent you from getting into that diabetes stage. And even now we're finding evidence that even people with a formal diagnosis of diabetes on medication can go into what we call remission of their diabetes. And
I've got so many stories. I cannot tell you. Diabetes is old news now.
Yeah.
Diabetes you can reverse pretty, or at least reduce your medication hugely. And if you're on insulin, you can reduce those, but always with the help of a specialist who understands.
Yeah.
And so Plant-Based Health Professionals is a wonderful website in the UK where you can actually access doctors who also understand the role of plant-based eating and can guide you, because you can't do these things on your own. And so that's important. But yes, there are some very big, wonderful people in the space, Dean Ornish, Dr. Neil Barnard, Dr. Michael Greger, Dr. Michael Clapper. And so there are a lot of people, and Dr. Milton Mills. So, there are a lot of people out there who are doing great, great work. And all one has to do is just look for that. And so I put a whole lot of resources in my website as well, so that people can actually understand, because, these are things that you can help yourself with, because especially now with the COVID-19, we know that people of color and Black people especially are dying in higher numbers. If you even have a BMI of more than 30, forget, morbidly obese, you have, a much higher chance. And whether you are Pakistani, Bangladeshi, Indian, or Black, you have anywhere between a 10 to 50% higher chance of mortality compared to the Caucasian population. And then on top of that, if you have front-facing job, if you are a key worker, you are overweight, you are basically, inviting COVID into your life, and vitamin D deficiency as well. So it's really important to understand that lifestyle has a role to play from the time you are in your mother's womb, because of epigenetics, and what you eat is going to influence your grandchildren's outcomes. So there's a lot of information out there that people need to know.
Yeah.
And simplified. You don't have to make it complicated, it's just very simple. And maybe we can talk about what I normally recommend, but we'll talk about endometriosis and then we can go into that maybe.
Yeah, definitely. And so coming into endometriosis, it's one of these things that people have a really long sort of journey from onset of symptoms to then getting a diagnosis, and also perhaps because the current way of diagnosing formally is by a surgical procedure, which is laparoscopy. And people do struggle quite a lot, with endometriosis, with pain and, trial of hormones, different hormones here and there to try to regulate the periods and try to reduce the pain. And then also quite a lot of painkillers and, quite a lot. So what can you tell us about endometriosis before we then get into sort of trying to manage symptoms with a plant-based diet?
Yes. So endometriosis is actually much more common than we think. And we think that 10% of the population may actually be having endometriosis. What is actually the condition? It's a condition where every month when you menstruate, the blood comes out of your womb, the lining gets shed and it comes out vaginally. But some of that blood may go and stick itself outside, either through retrograde menstruation, which means the blood goes through the fallopian tube, sticks itself on the ovaries, on the back of your womb, on bowel, or there may be other mechanisms at which the blood may transfer itself to your lungs or your nose or to your scar tissue. And we know women after cesarean section have higher chance of having endometriosis. So what happens every month when you bleed, you um, the endometriotic deposits also bleed. And so that's what causes the pain. And so that's why we know that pregnancy is meant to be to dampen the endometriosis. And so the reason why endometriosis is a modern condition is, if you think about it, 100 years ago, before that, most women would have start their period, say, at the age of 10, 11, 12, and then they would have a baby by 13, breastfeed for 2, 3 years, then have another baby by 16, and either they'd be dead in childbirth or they would have 10, 12, 15 children, and probably would have had about 4 or 5 periods in their lifetime. Yeah. Okay, by the time they reach menopause, if they live till menopause. Most women died by 35. Now, if you imagine the modern woman, they have either no children, 1, 2, 3 children, and so they start their period at the age of, say, 12 or 13, and by the time you stop your period, which is generally universal all around the age of 51, you have between 450 to 500 periods in your lifetime. So having periods is not normal, it's not natural. People often think it's a natural thing to have periods, but actually when you are, if you were meant to be living, a couple of 100 years ago, you would have been just either pregnant or lactating. Now, we're not saying people should rush out and start having children, because obviously that comes with its own complications. But it's important to understand that this continuous onslaught of periods is what then triggers endometriosis in susceptible people. So there may be a family history and things like that. But lifestyle then can play a big role as well. Yeah. So the problem with diagnosing endometriosis is a lot of women anyway have painful periods, either because of their diet or because of other underlying conditions. And so you go see your doctor and say, yeah, it's quite common, do something, take some painkillers, off you go. And when actually they may have underlying endometriosis already. Now, they either that or they have bowel symptoms. And so you may be diagnosed as irritable bowel syndrome. So either you are not being diagnosed with endometriosis or you may be diagnosed with some other pelvic pain or irritable bowel syndrome. And so you don't get a diagnosis. Now, the important thing to understand is that the American Fertility Society has classified endometriosis into 4 grades. And so you have the minimal and the mild endometriosis, a grade 1 or 2, and then you have the moderate or the severe. And people often think that from the minimal or mild, you go on to become moderate or severe. But actually, in my 40 years, 35 years of experience and 40 years having joined medical school, the thinking now is that it's actually more to do with either you stay in the minimal mild group or you stay in the moderate severe group. And so early diagnosis is important because fertility can be affected, chronic pelvic pain, you can miss work. There are more work days missed by women because of painful periods, and endometriosis is an important cause. And you look normal from outside. So what happens is nobody believes you. Yeah. Okay. And so it's not like having, and I've got a article that I wrote for the Huffington Post, is endometriosis a fate as bad as cancer? And if you actually talk to people who suffer from endometriosis, they don't have any sympathy from anybody. They have to get on and carry on doing all the stuff, but they are crippled with pain, often in the lead up for 10 days before their period. During their period, they may have a few days of respite and then back again. So if you're going to be on the pill, so the hormonal contraceptive pill, the combined oral contraceptive pill, or the progesterone only pill, or the Mirena coil are very useful if you're going to use contraception or if you're having heavy painful periods and you're not sexually active even, because what it does, it helps to normalize your hormones. But the combined pill should not be taken with a break every month like the recommendation, because there is no medical indication to have a withdrawal bleed every month. So if you want to reduce your chance further of endometriosis, if you're going to be on the pill, you take it back to back so that your hormone levels are stabilized, you don't keep having these fluctuations, and you take it back to back and you have a break whenever your body tells you to. In the sense, you can go for 3 months without a break, 6 months without a break, a year without a break. There's no harm from that. Not everybody wants to take the pill, the combined pill, or if you've had children and you want to, or you can't tolerate the pill, you might use the Mirena coil, which is a progesterone coil, or the progesterone implant, or the injection. But doing nothing once you have a diagnosis of endometriosis can be really quite hard. And the only way so far is to see somebody, a specialist like myself, and you have an ultrasound scan. Sometimes the ultrasound scan will show chocolate cysts, which are collection in the ovary of blood that look like dark chocolate when we operate. That's why they got this name called chocolate cysts. But they're basically endometriomas, and severe or moderate cases will show that on ultrasound scan in some situations. Or you may see on an MRI scan that the bowel is not moving so freely, or the womb, the uterus is stuck to the bowel. You might see some of this scarring and things. But in a lot of girls with minimal or mild endometriosis, they're having all the pain, but you can't see anything on ultrasound scan. So the only way of diagnosing and treating is through keyhole surgery. But it is an invasive procedure. You don't want to subject yourself to it unless you really need it. So that is why it's so important for women to understand the role of hormonal contraception along with surgery. But there's a lot of stuff you can do right from the time before you even start your periods. And so that is what I'm trying to educate women. And once you have a diagnosis of endometriosis, you can also make huge changes in your lifestyle, in your diet, which can either save you from my knife, or it can make getting pregnant easier, or it may completely mean that you don't have surgery at all. So, or come off your medications, you know. So it's important to understand that lifestyle medicine is not alternative medicine.
Yeah.
Okay. So, but lifestyle medicine uses Western medicine. It walks alongside Western medicine. So you're doing surgery, you're using medication, but where it's appropriate, but you're also using lifestyle medicine, because there's no different diet for diabetes and no different diet for endometriosis, or no different diet for breast cancer or Alzheimer's or prostate cancer. It's the same diet for whether you're a child or a man or a woman or transgender, doesn't matter. You have the same diet. And so this is important for us to understand that whatever your the color of our skin, whatever our gender preference, it doesn't matter. The diet remains the same. And that is important to understand, because endometriosis can leave you with scarring, with lots of repeated surgery, open hysterectomy, open surgery leading up to a hysterectomy, where you remove the uterus and sometimes the tubes and ovaries as well to relieve the pain. But the pain often just doesn't go away because your bowel is scarred. You may end up with, having a colostomy, where you actually have an opening where your bowel has to be cut as well. So it has got a lot of repercussions, and we can try and do other things that will help us. That's all I'm saying. It's not 100%, but it's certainly something that we must put as doctors information for our patients so that they can be guided.
Yeah, definitely. And I think before we started the episode, we were both having a chat about how the curriculum for medical training is the nutrition information is so scanty. There's hardly anything in there, and so our understanding of that, even when we're counseling patients and talking to them about their health and their diet, there's just not enough. And even sometimes people with the right mindset sometimes also don't know where to direct patients to, where the right information is as well.
You're very right, Mo, because in medical school, most people are just taught what is a calorie and how many calories does a gram of fat or protein or carbohydrate have. That is the limit. So doctors feel inadequate and underconfident to discuss. But that's not an excuse. You see, when you have a heart attack, if you come to see an OBGYN or a GP, you're not going to say, I feel underconfident, so I'll turn you away. You send them to the right people. And that is what we have to understand, that we have dietitians who we can train in plant-based nutrition, nutritionists. We can educate ourselves. There are lifestyle medicine doctors like myself. There are GPs who understand lifestyle medicine. So there is places where people can be directed. Plus, we need to bring it into the curriculum, because it is really important to have a basic understanding. Nobody's asking the ordinary doctor to make diet plans. Nobody's asking for that. All we're saying is know that there is help available for remember, 80% of what you see more in your surgery and 80% of what I see as a specialist is chronic lifestyle conditions. Okay. And so it's polycystic ovarian syndrome, endometriosis, endometrial cancer, fibroids, putting on weight, menopause. These are all the gynae side of things. Literally, there's no gynae condition that does not benefit painful periods, Same thing in the GP practice: diabetes, hypertension, heart disease, stroke, Alzheimer's, dementia, all these things. And all these things can be helped by eating the right way, sleeping the right way, stressing less, all these things. So we'll talk about the 6 pillars of lifestyle medicine, how it can help with endometriosis. But it's important to understand that as doctors, we have a duty of care to inform people, whether we feel confident about it or not. Our duty is to provide the information so that the person can go away. And that's the beauty about lifestyle medicine. You, as the patient, are in the driving seat, not your doctor. You decide how much of this you want to take on. And so that way you can bring in acupuncture, functional medicine, Western modern medicine, everything can come in. There's a place for everything, but you decide. And that is the difference. While conventional medicine, the doctor decides, yes, you need a laparoscopy. Yes, you need the pill. No, I need to give you all the information. I need to guide you, but you need to then take the final step rather than doctor knows best. No, you know best for your body. You need to get all the information though, because if you don't, you will make the wrong choices. And of course, if you just look on Google or anywhere, you get very confused because there is so many myths. So you have to follow the science. It has to be evidence-based. And that is the definition of lifestyle medicine. It is evidence-based therapeutic approaches that uses lifestyle to prevent, treat, and in some cases, reverse lifestyle conditions. 80% of what we see in our practice is lifestyle related. So, we really need to wake up and start doing this.
Making the difference. Yes, definitely. And so you just mentioned about the pillars of lifestyle medicine. So how can we apply those pillars to endometriosis for better outcomes?
Very good. So there are 6 pillars that are there for lifestyle medicine. And we will do it from the reverse so that nutrition is the biggest umbrella.
Yes.
But if you have the 6 pillars, there is a nutrition, there is sleep, there is stress management, there are avoiding risky substances or risky behavior, there is exercise, and there is maintaining positive social connections. Okay. Now, we know that each of these has a role to play in all chronic conditions, including endometriosis. So because with endometriosis, you can often tend to be low in mood and depressed, having friends and family that care for you, you reach out, you do community, be active in the community, whether it's doing charity work or having lots of friends, we know will help with overall mood and makes you take better choices. Then we come to avoiding risky substances. We know that smoking and alcohol are all pro-inflammatory states. So drugs, smoking, alcohol are big no-nos, really, if you want to lead an optimal health. Yes, if you want to have a celebrity glass of champagne on somebody's birthday, that's not a problem. But really, there is no safe limit of alcohol, whether you're pregnant or not. Yeah. Avoiding risky behaviors. So, important that you always use condoms, whether you're on the pill or the coil or anything in any new relationship, because getting an infection like chlamydia or gonorrhea can leave you with long-standing pelvic pain and subfertility, and that can make endometriosis much worse. So avoiding risky behavior, having positive social networks and connections. The next thing is stress management. We know that stress is very intimately related to cortisol and the way you sleep. So good stress is very good. So, when I'm coming up to do the podcast, I might be a little bit anxious, and that's good stress because it motivates you. But if you're having a partner who's violent, or you're having bad work colleagues, or you're having lots of other stress from your health, then that's going to disturb your sleep. And so we know that stress will basically cause hormonal imbalance, estrogen and progesterone, cortisol, melatonin, the prolactins, all these will get affected. And with stress, what then happens is that you can't focus, and then you make bad choices again. So you can see how stress is really important. And why is sleep so important? Because when you don't sleep, as doctors, we know when we do night shifts, and as an OBGYN, I know that. So what happens is that you basically have cortisol levels that are up the spout, your melatonin levels don't come down, and so you end up getting having poor sleep, so you get very stressed, and that makes conditions like endometriosis and polycystic ovarian syndrome and menopause and painful periods much worse. So we must sleep 7 to 9 hours, and for everybody, including somebody who's suffering from endometriosis, you need to have good quality sleep. There's no point just lying in bed. Bed is meant only for sex and for sleeping. Okay, so you need to be able to sleep 7 to 9 hours. If you sleep longer, that's been shown to be not so good for you. If you sleep less, again, it's not so good for you. Your chromosomes and your telomeres can get damaged. Your cell repair happens during your sleep. Your DNA repair happens during your sleep. Your hormones balance during your sleep. So if you are not sleeping, the endometriosis will go out of this control, and that will increase your stress levels as well. So sleep is really important, and I have lots of tips on how one can sleep: having dark curtains, wearing an eye patch if you need to, listening to soft music if you need to, no television, no screen for at least 45 minutes before, cool shower, a nice cup of chamomile tea a few hours before, so that you're not rushing to the toilet in the middle of the night, little things like that. Okay, so sleep is important, avoiding risky substances, smoking and alcohol and drugs, risky behavior, positive social network, really, really important. Exercise is really important as well. And that, by that, I don't mean going and pounding things at the gym. Okay, you can if you want to, because if you're at but having a standing desk, moving naturally, whether you go for a walk, whether it's gardening, you need to be aiming with endometriosis, not for the 150 minutes of moderate intensity. I would recommend 300 minutes, because that's what actually has been shown to make a difference. So that's about an hour a day. Okay, of which 2 sessions should be weight training, because you need to build your bone and muscle during this time. So it's really important that resistance training, high interval intensity training. So if you're walking, walk as fast as you can for 30 seconds, then slow down. If you're running, run as fast as you can until you're out of breath, because you want your heart rate to go up, because that normalizes the hormones. And in endometriosis, your hormones tend to be all over the place. So exercise is really important. So a rough way is 1 hour per day. Okay, but that means that you're doing gardening, housework, walking around, running up the stairs, avoid taking the lift, simple things which can make a big difference to your pain. Because we know that girls who suffer from painful periods, if they exercise in the lead up to the period and exercise during the period and do yoga and things that will relieve stress and Pilates for core strengthening, we know that their periods become much less painful, because the prostaglandins that are released by this endometrial tissue gets washed away in your blood supply, so that you actually have relief from the pain, because prostaglandins can cause nausea, vomiting, diarrhea that often accompanies these painful periods, but also causes pain and heaviness. So exercise is really important. It should not be something to be done just on weekends. It's fine. You can be a weekend warrior, but really you want to factor it into your day, walking to work, cycling to work with a helmet, So things like that is really key. And then you have the most important of the 6 pillars: so the exercise, risky substances, good social networks, stress, and sleep. And then the 6th most important one is nutrition. And the American College of Lifestyle Medicine, based on thousands and thousands of peer-reviewed studies, is now very clear that one should be eating a predominantly whole food, plant-based diet, which means that your diet should be chock full of fruit, not whole fruit, because it comes with the fiber. Fiber is what traps the estrogen in your gut. And so you don't have all these high estrogen levels, because endometriosis, like fibroids and like polycystic ovarian syndrome, is a high, and breast cancer are all high estrogen states. So you want to be eating lots of fresh fruit, lots of vegetables, especially green leafy vegetables, which are full of nitrates, which will dilate your arteries. So broccoli sprouts, and kale, and spinach, and beet greens, and things like that. So fruits, vegetables, whole grains, which means black rice, wild rice, red rice, brown rice. These are quinoa, millet, spelt, rye. You want to eat grains as intact as possible. So porridge oats, porridge groats. These are grains that you want to include in your diet. Potatoes, sweet potatoes, complex starchy carbohydrates. We know keep you full for longer, reduce your blood sugar, balance out your hormones. So it's really important that you eat potatoes, sweet potatoes, intact whole grains, and a lot of legumes, which are beans like chickpeas, kidney beans, soya, lots of dals and lentils and pulses, lots of herbs and spices, and a small handful of unsalted nuts, walnuts, cashew nuts, and all kinds of nuts. So you want to try and eat, especially if you have no weight to lose, you want to eat a normal whole food plant-based diet. If you have endometriosis and you're overweight, you want to try and eat more low fat. So you don't want to have too many avocados and too many nuts in your diet, because that can then cause a little bit more inflammation. Soya is really important. All studies have shown, especially big study in Japan showed that women who eat soya regularly in the form of miso, edamame beans, tofu, tempeh, soya milk, have the lowest risk of moderate and severe endometriosis. We also know from the nurses' health study, the Harvard study as well, that I think it looked at something like 70 or 90,000 nurses, that women who ate red meat regularly had a much higher chance of developing endometriosis compared to women who ate it very infrequently. Okay, chicken was also important, but not as statistically significant, but also worsened the chance of endometriosis. And so we know that citrus fruits and green leafy vegetables positively reduce your risk of endometriosis. And while, for example, alcohol increases the chance of fibroids. And now often when you have endometriosis, you also will have fibroids. You also have adenomyosis. Adenomyosis is the cousin of endometriosis. So it's where the lining of the uterus digs deep into the muscle wall and grows every month with the period. So that is why it's so important that you eat anti-inflammatory foods. And anti-inflammatory foods are plant foods. They're rich in fiber, low in inflammation. So they basically open up your arteries in your heart and open up the arteries in your uterus. And so it's really important. And soya contains plant estrogens. And phytoestrogens are very important to reduce your risk of endometriosis and breast cancer. So even if you have a diagnosis of endometriosis or breast cancer, the more soya you eat, the lower is the risk of prostate cancer and breast cancer and endometriosis. Why? Because the phytoestrogens work only on the beta receptors of estrogen, while the ordinary estrogen that is there in chicken and fish and meat and, in tissue, not fish so much, but in tissue, animal tissue, and in our own bodies, is that estrogen goes and blocks both alpha and beta. But the soya bean is so clever, it only works on the beta receptors. So what it does, in your bone, it strengthens it and prevents osteoporosis. It makes your hot flushes better, but in your breast and in your uterus, it dampens things down so you don't get cancer. And it's a very clever bean, and 20,000 studies have been done, and still there are so many myths about soya. It doesn't affect fertility. It helps fertility, if anything. There's a 27% chance reduction in prostate cancer. There are huge studies in fertility and sterility journal, in the fertility journal, as well as in the American Journal of Clinical Nutrition. So there's so much of information. China, which is one of the most populated countries, lives on soya. So we don't need to worry about our reproductive health. And man boobs comes from the mammalian estrogen. So when you drink dairy and when you eat these sort of foods, that's when you get man boobs, because that's what happens. That estrogen cannot be broken down, unlike phytoestrogens, which basically are plant estrogens. They are there in blueberries. The same phytoestrogens that are there in soya is there in chickpeas and kidney beans, but it's just that soya has been given a bad press, both by the dairy industry as well as just by confusion, because it behaves slightly differently, because the earlier you start as a child, the more is the benefit. So people say, oh, I took soya, when tablets are not the same. Okay, don't supplement with tablets, because any of these supplements don't do the real job. It's a reductionist approach. Basically, you can't take one element out of nature's bounty and expect it to do the same that a soya bean that has got 10,000 other things and fiber and protein and vitamins and minerals and all the beautiful things. So my take home message for endometriosis always is that focus on eating a whole food plant-based diet, get rid of the junk foods, the ultra processed foods, the animal foods, the excess oil from your diet, and add in the herbs and spices. They give you a lot of antioxidant, anti-inflammatory boosts. And there are plenty of fantastic websites and fantastic accounts that you can follow, which will teach you how to eat this way. And you will see the proof is in the pudding. You will realize if you do this for 3 weeks, you will see the difference almost within the next 1 or 2 menstrual cycles. So it's huge. You can't melt away the big growths in the ovary and all that because that's hard. So that's why starting early is so important, but it has a place. No patient of mine comes with endometriosis and goes away without being explained to about the power of plants. I've just had one of my patients, she's just delivered her baby. She was actually a pescatarian and then became a vegetarian and had moderate to severe endometriosis, came to see me. She then changed her diet to a completely whole food plant-based diet. Within 3-4 months, she got pregnant.
Wow.
And now she's just had her baby. So that's really nice to know. I operated on her because she did have chocolate cysts. But it's amazing, amazing. So it's not that it's going to be a magical cure for everybody, but it's certainly give you good quality of life or a better quality of life than you are experiencing. That much I can guarantee. And when you are doing that way of eating, because remember the plant-based diet, a whole food plant-based diet is the only diet that has been proven to reverse heart disease. And heart disease is the biggest killer for men and women, and more women die of heart disease than men. Okay. And so especially, and we know mental health is also affected. So it's really important to understand that the same diet that protects your heart and protects your brain also protects your uterus. So, there is no magic pill. There's no money to be made from eating broccoli. But, and that's why nobody talks about it. You understand?
Yeah.
And I think doctors don't mean badly. It's just that they're ill-informed and they get their nutrition news also from the same sources that their patients get. So, one day butter is back, one day ghee is back, next day butter is bad. That's because they don't know the science. And once you know the science, then it's very clear that we have evolved to eat plants. And the closer you move to eating whole plant foods, the better, the more benefits you're going to reap. That's the important thing. People say, oh, I can't go 100% whole food plant-based. Nobody's asking you to do it. If you don't have any health problems, don't do it. Even if you have health problems, if you don't want to go 100%, don't. Just do 5%. 5% is better than 0. Do 10%. Start with breakfast. Just take your breakfast and swap the dairy milk in your and your cereal full of sugar with porridge groats or jumbo oats or steel cut oats. Just do that with soya milk and, oh, I don't like soya milk. Okay, then have oat milk. So it's not that if you just start with breakfast, then you feel more empowered. Then you make lunch. Have a big soup, vegetable soup, or have baked potatoes with baked beans and steamed vegetables and a large salad, or just have a huge salad with hummus and some falafel that's baked, or have sweet potatoes with chickpea curry. In the evening, have brown spaghetti with a big celery, tomato, bean sauce, or have a tofu stir fry, or have, I don't know, a burger that is made with beans, or you can have the other cheap meats and all, but they're meant to be eaten as treats. So you really want to be focusing on whole plant foods. And it's such a joyous way of eating. You don't miss anything. There are 20,000 plant species, and so hankering after 3 animal species that we eat, is just, it doesn't make sense. So the closer you move, start with breakfast, make lunch, then maybe you have a whole plant-based Monday, and then you make it plant-based Tuesday, and then suddenly you're off and running and thinking, why did nobody tell me this pot of gold before, this secret that everybody seems to be completely unaware, and once somebody finds it, all they want to do is talk about it. So
yeah, you know, it's absolutely amazing what you just said in terms of, you know, switching out milks. That is something that I generally just encourage a lot of people to do, especially people who are finding that they're having bowel issues or, you know, irritable bowel syndrome, and they're not able to sort of specify, and, you know, they have a cereal every morning or have some milk in their tea. You know, just switch it up, switch it to soy, you know, hazelnut milk, almond milk, and, you know, the possibilities with milks now that are plant-based, endless, really.
Exactly. Exactly. And once you understand that you don't like soya, that's fine, you know, but soya is great for you in every form. But if you don't like soya, there are other options. So it's just understanding that, you know, you don't have to go 100%. It's great if you can, but if you can do, and I actually tell people, don't go cold turkey straight away. Watch the movies, watch Forks Over Knives, watch The Game Changers, go onto my website, read the books, How Not to Die, and, you know, Dr. Bernard's book, Your Body in Balance, and things like that. So once you've read this information, you've empowered yourself with the knowledge, make a chart of what you eat on a daily basis. And then you look at what can the swaps you can make, where can you make it? And then slowly it becomes, oh, how do I add more color to my plate? If you don't want to get rid of your fish, make that piece of fish half and substitute it with a bunch of beans, or, you know, edamame beans, or chickpea curry, or, and, you know, simple things like that. Big salads. Your plate should be bursting with color. When they say eat the rainbow, it's really important. And it's not 5 a day. I know 5 a day is what they tell you here, but actually Canada and Japan, it's about 10 to 13 portions. And one portion is what you can hold in your hand, about 80 grams. So you want to aim for 5-6 different fruits in a day, especially berries, which are really important, blackberries, blueberries, if you can have access to it. You must shop late in the evening so that you can get good deals. Shop in open markets. Grow your own little herbs in a little window sill pot, so that you are saving money, and buy in bulk. Buy beans and rice and, you know, quinoa, all these things, whatever you want to enjoy and eat. Potatoes, sweet potatoes, buy them in bulk. So that's what I tell university students and people who can't afford, that you don't have to eat, you know, a fancy meal somewhere. You can just be eating what is really cheap, but absolutely healthy. Beans, whole grains, fruits, vegetables, herbs and spices. That's what you need to be eating. Simple, simple, simple stuff. Make small changes. Takes about 3 months for our gut bacteria to change. So that's why when people suddenly cut out things, they'll say, oh my God, I feel tired, I feel weak. That's because the gut bacteria, which we have about close to, I think, I don't know, 100 trillion or something. They're huge numbers, much, much more than our own body. So these gut microbiome bacteria are specific for each types of food. And so when you feed them the plant foods and the fiber which they munch on, they are known, those are the prebiotics. So prebiotics are fermented foods and all fruits and vegetables and beans and things. Those prebiotics are eaten by probiotics, which are the bacteria. So when you take a probiotic tablet or capsule, that's just a few colonies of bacteria. So that's not really going to help you if you don't change the way you eat. And so prebiotics feed the probiotics, which is the bacteria, which then produce the short chain fatty acids, the butyrates and all, which are the postbiotics. And that's what causes the health benefits. And it boosts your immune function and, you know, suppresses your endometriosis and things. So lifestyle medicine has a big role, whether you have no condition, some health condition, women's health conditions like endometriosis, whether you're worried that you may develop it because there's somebody in the family, or whether it is you have the condition and you want to see whether you can have a better quality of life.
Yeah, definitely. And, you know, it's so important in terms of understanding and going on, you know, your own personal experience.
Totally.
And, you know, when I was put on the combined pill, my already horrible, painful periods became even more painful, and the bleeding was worse. And it was a situation where I was like, well, I'm not having surgery yet, and I'm not having my fibroids removed yet, but I don't think I'm going down this estrogen route. So let's remove the estrogen pill, and let us also try to remove as much estrogen from my diet as possible. And let us see, and maybe we can try with progesterone. But yeah, let's try to limit the amount of estrogen that is coming into my body. And I love what you said about, you know, the soy being so selective in the kind of estrogens that are in there. And I think this kind of information and understanding why your body reacts in a certain way then allows us to be able to make
Totally.
specific changes.
Absolutely. Now, obviously, the control that you get with the combined pill is second to none. And it also, taking the pill for about 4 years halves your risk of ovarian cancer and womb cancer. And so the important thing, if you're going to be on the combined pill, because you need for contraception, it's one of the most effective, then you want to take it back to back. That's where the painful periods don't then become an issue anymore. And so it's just understanding and suiting the right thing for the right person. But without the knowledge, what happens is you have myths. And as a result, you then deny yourself very important modern advances in medication. So because people have a fear of the combined pill or the mini pill or the injection, or they are taking it blindly without knowing that actually it's not really, they're not doing anything else. And I have a very detailed leaflet on soya on my website. So I don't know if you can link it all.
I'll link it in the footnotes of the podcast.
If you just put my name in, it's www.nitubajekal.com. And of course, I'm also active on Instagram as @Dr Nitu Bajekal.
It's amazing. And thank you so much for coming on. And just one last question. I think there's been a lot about ginger and the use of ginger in terms of managing pain and helping with metabolism as well. What can you say about using ginger?
So there was a nice study by the doctors in Iran, and they of course, because you can't give people ginger and some placebo, they put it as ginger powder into a pill. Okay. Because ideally you want to eat the ginger root, really the ginger, grate the ginger, put it into your lemon water, put it into your dishes. And we know that eating ginger 3 to 5 days before your cycle period starts can make a significant difference to the period pain by, again, the anti-inflammatory method. But again, I want your listeners to realize that it's not one superfood. So ginger is very good for morning sickness and for painful periods and nausea in chemotherapy and things. But as I said, it comes under the group of herbs and spices. So garlic and ginger, we know garlic is an anti-cancer, and we know women with endometriosis have a higher chance of ovarian cancer. So, once you understand that no dish of yours should pass into your lips without having some herbs or spices on it. So whether it's cilantro or coriander, whether it's parsley, basil, thyme, rosemary, doesn't matter, mint, put some fresh herbs, put dried herbs, put lots of spices, turmeric, which is of all the anti-inflammatory, turmeric comes first, and you want to always add a pinch of pepper to your turmeric, because pepperine in pepper boosts the antioxidant power of curcumin by 2,000%. And just adding any herb or spice to a dish, whether it's a dal that you make or whether it's to your baked potatoes, when you add some herbs and spices, it increases the antioxidant power by 200%.
Wow.
So first comes turmeric, then comes ginger and garlic, and then you have all the other herbs and spices. So you want to increase. Cumin helps with digestion and bloating and diabetes and fenugreek. You want to use a range of spices in your cuisine, in your diet, and that's where you rely on all these fantastic cuisines that we have, Indian cuisine, and Nigerian cuisine, Asian, Chinese and Japanese foods, and Ethiopian, and the sky is the limit. And that's what I found when I turned completely plant-based. Wow, you mean all these foods were there? I had no idea at all. All I was doing was chomping on, cheese toasties, nice as they are, and so yes, there's vegan cheese, and yes, I'll sometimes have that. But really, I'd much rather have avocado on sourdough bread with a tofu scramble on the side. And so it's not that any food is bad, not that eggs and fish are bad for you. They're not great for you. So because we only eat a certain amount of food, what you put in your mouth is really important. So every time you eat a donut, you're missing the chance of eating a big bowl of mango with some blueberries in it and some dark chocolate drizzled on it. Every time you eat an omelette, you're missing the chance of having tofu scramble. Every time you have a piece of fish, you're missing the chance of eating a big bowl of beans or chickpea curries and things like that. So it's not that any food is bad. It's, yes, some foods are worse than others. But when you eat plants, you get all the benefits. And that is something that really is important to, once you understand it, once you know, you can't unknow.
Yeah, I love that. Once you know, you can't unknow. Thank you so much for coming on this episode. It's been and I knew that it was going to be amazing, but it's also been very eye-opening for me in terms of just, and what you said about the cuisine that is available all around the world, and a lot of these cuisines that you've mentioned are so rooted in plant origin, and in terms of us going back to our roots. And you were talking about it before we started recording, about how the kind of foods our ancestors ate, and how they lived and lived from eating from the soil, and that is just so important. And once we start making the right kind of changes, then we empower others as well to make the right change too.
Exactly. That's what it's all about, is living the best life that you can, that is kind and compassionate, and that helps not just yourself, but the people around you, the children who are far away, who are starving because of the choices that we make, the animals that are suffering every single day because we haven't realized there is another way to eat. And at the same time, you're staying as disease-free as possible so that you are there to help people around you. I think that's really important for us.
Thank you so much, Dr. Bajekal, for coming on today's episode.
You're welcome.
Thank you for joining us on today's episode. Do share this podcast with 2 people who have not heard about us before. Remember that this podcast in no way replaces advice from your own doctor or physician. Do subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And do join the club at asliceofhealth.club and drop us some suggestions or questions that you might have. Don't forget to be a health champion wherever you go by separating health fact from health culture.